So welcome to the Chateau. Today we are going to talk about anti-aging with Dr. Mera. Good aging from inside to outside. So please, Dr. Mera, explain us what we are doing with your patient who are coming to see you.
Well, aging is a process that is not an illness itself. So the only thing that we look for is harmony. We have, with the process of aging, when you lose the harmony, you are more likely to have illnesses. So my task is to try to get again that harmony that you have lost and try to prevent illnesses. That's all. So that harmony is what we are looking for.
So I'm happy you are talking about harmony because we are doing more or less the same job in a different way. Looking for harmony with people. Me also, I try to make the people feel better, trying to compensate the loss of volumen, the loss of collagen. With age, we are losing a lot of collagen. We know that normally they say that when 25 years old, you begin to lose 1% of your collagen. And after menopause, you are losing, for women, 30% of the collagen in 5 years. So I think in this moment, I can do things, but I think it's more important for them to come and to talk with you.
Yes, because in the same way, I can say that you can lose 20% of your energy, 30% of your memory, 20% of your brightness, your smartness. There are many things that you can lose as well from inside. And we can try to compensate that. Not always we can recover everything, but we can compensate with mostly three things. It's a healthy food that we recommend, exercise, moderate and constant exercise, and it's essential the management that you can do of your stress. Stress management is essential for that. According to that, there are 3 or 4 things that we also check. Is hormones, very important, and particularly in the menopause. But in the same way that you look at the patient and you look at the face, you look at the neck, you look at the hands, and you try to add what they need, we do exactly the same, but we test hormones, we test minerals, we test vitamins, we test certain biomarkers that will tell us how is the aging process going and where is the harmony, and we try to find out that and supplement. We try not to exceed the possibilities of because then it's very difficult to find the harmony. So supplement what we are needing, okay? This is what we do.
If we are talking really about hormones for women during menopause, every woman can use the hormone, and one moment they are seeing there are very many risks for breast cancer, so for that many women doesn't want to do it, and I send them to talk with you. Do you think that more or less everybody can do it? Where are the conditions? Until which age?
Yes, we can start with the hormonal replacement. The first moment, the sooner the better. It's always as soon as we detect that there is any problem, we have hot flashes, mood swings, and loss of memory. These sort of things we can identify, and we can start to do that. Everyone. Well, not really. Why? Because there are some side effects. Everything has side effects, and the hormonal treatment it's true that has some side effects, but we can identify perfectly the group of women or men that can have side effects. Breast cancer, for instance, we have the way to identify those women who can take it or not. Obviously, the family history is one of the things, but we have some genetic tests that we can, or genomic tests that they can tell us if the patient is in high or low risk. Normally, in my experience, we have 3 groups of patients. Those who respond very well to the hormonal treatment. They change dramatically. They rejuvenate constantly. There is another group that they really improve a lot, but not spectacular. And finally, the group of women that might have side effects. My advice is that we use only the first 2 groups, and the third one, well, we have some other treatments, not necessarily hormonal. We have certain supplements, certain precursors, some other things that we can do that too, in order is in that group where the risk is higher than the benefit. I think that, but normally we can help 2 out of 3 women. So this is very interesting, of course.
Yes, and me, I'm quite interested in this third group because people normally don't know what is aesthetic medicine. They were thinking also always about Botox and filler, but in the SHA, for example, we are very concentrated in treatment for compensation of the loss of collagen, but also in talking about sexuality. Because in this moment of menopause, you have many problems also in this part of the body because you have more dryness, lack of urine or things like that. And this third case normally can be compensated by hormone, and we have also some laser who are helping them to feel better. Do you know this treatment?
Yes, of course. This is very interesting. Of course, I'm interested in sex life. I'm not an expert in sex life, but I ask always my patient about their sex life because when you make love is when you feel perfect. We all know that there is always an excuse not to make love. I have headache, I feel tired, I feel weak. So on the other hand, when people make love constantly, regularly, and so on, that means that they are perfect. So if you make love, that means that you are perfect. If you don't make love constantly, regularly, that means that you are not all right. So when you are in that group, we have to find out the ways to improve. And normally it's hormonal treatment, of course. And the sex is a combination of two factors. One is the sex drive, make you prone to the arousal to get the relationship. But there is another thing that is physical. And there is a lot of change that make it difficult. Dryness, problem with elasticity, and it's a sort of vicious cycle because if you have pain, you don't want more, and you have more dryness, and so on. So we can improve greatly. I think that is a wonderful way to go together in that harmony that we were looking for. From inside, I mean, give you sex drive, give you energy, give you elasticity, and on the other hand, make it better physically for the intercourse. So I think that is one of the places where we can work together with more efficiency, obviously. So tell me, what things are, this is the best area where we can work together. What do you exactly do? Tell me, what can we do with that?
Well, I'm very interested in this part because it's quite new in the aesthetic medicine. We have seen that to feel well, but we are saying it's important to feel well also with your sexuality. When people, I think it's important to have the substitution hormonal. Also, you can have local hormones. You have also some creams that you can put every day with hyaluronic acid, with something with moisturizing. But that all this stuff can be difficult for women because it's something that you have to do every day. And you want to have a natural sexuality and not thinking of that every day. So we have some treatment in aesthetic medicine. We can help them to feel better and for long term. We have, since a long time, injection of hyaluronic acid with a very good moisturizing because this product attracts the water and helps all the mucoses to be better. But we have also, what for me is very important, a laser with a CO2 laser with doing like little incision in all the vagina, and the healing makes that so you have a big stimulation of the collagen, that the mucoses have a big grow, so you have better elasticity, better secretion, and you can have a normal sexual life. This treatment is also very interesting with people we can't have this substitution hormonal, people we add cancer of breast or things like that, because we can find a way to have them to have a normal sexuality without hormones. So, yeah, it's quite interesting.
I think that is a very good way for both groups. I think that we can use that in the three groups that I mentioned.
Of course.
Because it can improve all those respond very well to hormones, all those respond pretty well, and those who cannot take hormones, of course. And this is particularly interesting, of course.
Alors, I'm going to talk about you because me, I have tools for women, but I know that also men with aging can have some problem around sexuality, and I think that you are doing things.
Well, for erections, yes, erection is a big problem, and it depends again on the same things. The sex drive, if you are interested in sex, obviously you have erections, but also there are many normally hormonal and vascular responses that with the pass of the time you lose. And if you cannot receive hormones, you should receive hormones if you need. Then there are the vascular problems. We smoke, we have cholesterol, we don't exercise, we don't manage our stress very well, and then this response, the vascular response, is really impaired. So what we can do is try to improve that. How can we improve? With everyone can buy in internet pills, the blue pill, and they can improve greatly. It is a good response. But obviously, there are a lot of side effects as well. So not everyone can take it. Cardiovascular, with the pass of the time, obviously, you also have a cardiovascular risk. You have also retinal risk. There are many problems with these tablets. So there is another physical option. Medicine is not only medicines. This is something that we will call medical and medicine and medical doctors, but we have some other possibilities. One is the physical treatment. I use personally some shockwave therapy. This is a new technique. We have identified that with the shockwave therapy is something mechanical that you can move. You can the arteries of the penis, and when you move it with this shockwave therapy, is something in the same way that the wind naturally do with a tree. When you have a palm tree and the wind is moving that, the only thing that you get of that tree is a beautiful leaves every day, better and stronger. This is exactly what we do. We move the arteries, and with this movement, we can produce more small arteries that they can produce a better circulation of this area. And we can prove with that, with obviously clinically tested, so people feel better, but this is not enough. We also test it with certain biomarkers. Particularly, there is a biomarker, very interesting for the growth vascular substances, and we can detect that. And when you remove the arteries, you can produce more substances that they produce more circulation. It's exactly the same way we compare with another part of our physiology with the bodybuilders. When you exercise your biceps, you do that, you make a small injury, very small injury, and they produce a lot of substances to produce more muscle and regeneration of the muscle, growth of that muscle fibers, and we do exactly the same. So when you move, you produce a micro injury of that circulation, and the micro injury produces better circulation, but it's only, the only inconvenience is that it's on a long-term basis. It's something that you don't do for today or tomorrow. It's on a long-term basis. My impression, but this just personally, is that the age of someone is not in the face, but is in the neck and the hands. What can you do for the neck and the hands? Tell me.
I'm quite agree with you. We can see the age of people with hand and neck, because normally they look after their face, they put sunblock, and you know that the sun is a very bad enemy of the body, and they forget the hand and the neck. It's a very difficult place because it's very very thin skin. And also in the neck you have this part where we have the thyroid, and we have many treatments that we can do because we don't want to damage the thyroid. But you have some radiofrequency was working very well. You know, the radiofrequency is something with eating the derm, and so like that it stimulates the fibroblasts and stimulate and creating a new collagen and elastin. So we can improve the quality of the skin. Also, we have some injection like Radies with hydroxyapatite calcica with a particle of calcium, and that also is an amazing skin booster and creating a big collagen. So we use it and we put like a nappage everywhere, and that stimulates the own collagen. Also, you can try it also sometime to work with cream. You have to be careful because the skin is much more thin, but you can put some cream of retinol. If we have time, we will talk about the retinol. And also we can moisturizing with some skin booster. It means that acid hyaluronic with capting water, and like we can moisturizing. In hands, we can do also the same. We can moisturizing, feel it, because with the time we are losing the fat and we can see all the tendon, and that's not very nice. But what is very important also to work on the spots, because normally in the hands we have many spots. That you have many ways to work on that. You can use a pulse light with something we work directly on the color. So if you are very white and the spots are dark, it's quite easy. In the contrary, if you are darker skin, it's more difficult. But in many times you can help to make it completely blurred. Or you can use the laser. We have some very good laser. We are doing like put out the superficial skin, and doing also stimulation of collagen and helping to put out the spots.
Yes, I have one problem with my patients, because I always recommend to take the sun, obviously because of the vitamin D. Vitamin D is essential nowadays,
Yes.
for many things, for the bones, to prevent osteoporosis and so on. But probably the sun is one of the worst enemy of the skin. So tell me, what is that? What do you recommend to the patients concerning the skin?
You have to know to do it perfectly. Normally you have to put 50 every day, and to put it again every 2 hours, and to put in all the body. You know that you will never do it perfectly. So you can protect your face. You can put 50 in the morning on your hand and your neck, and that will not influence on the vitamin D, because the face and the hands will be 5% of all your body. And also you will never do it perfectly. After, you have to choose the moment of the day. You know that in the morning is less aggressive, so of course it's very good to go outside, put your sunblock and go to walk on the, and you can help also the sun to work on your arms and all the body, not only on the face and the hands. The problem, you can go to the sun and to do careful and protect yourself, but face and hands and neck are always exposed. For that, it's very important to protect them, because this part is much more sensible.
Well, we have, from my point of view, some solutions, very easy solution, that is take a tablet, okay? Sometimes we have that, it's something new, by the way. 20 years ago, for instance, when I tested the vitamin D to all my patients, I didn't find this problem. It's something new. So the reason is that the vitamin D is, there is a lot of influences in the absorption of vitamin D. So sometimes it's not the sun. Remember that is very useful to activate the vitamin D, but we have to take the principle. So the absorption of this vitamin D sometimes is impaired, and you cannot absorb it because of a lot of substances probably in the diet or microbiome. So even people who, this is my experience, you say, well, your vitamin D is very low, and you say, well, how does it come about? I go to the sun, 2-3 hours every day. I take a very healthy diet, and why do I have very low vitamin D? And normally it's because there are interactions in the absorption of the vitamin D. So even if you take the sunshine the whole day, you don't increase it. So sometimes it's necessary to take a small supplement. The vitamin D is completely, is a very, no side effects at all when you monitor that and you take it in certain levels. So again, we can do both, okay? We can improve with a small supplementation, and we can take the sun, but with care, because the skin, obviously, the melanoma is a big problem nowadays. It's not only that your skin becomes bad, but you can have melanoma, particularly certain types of skin, white and so on. Tell me, what is your experience with exercise? Because I have had some patients that they had treatments in neck and hand, for instance, or face, by the way, and they use exercise for these areas. Do you know if there is any device that particularly you put in your mouth and you can exercise constantly the muscles of the face? Or you can do, there are some balls that you can exercise constantly your hands, and then you can full of muscle, not of hyaluronic acid, but it's muscle. And the same happens with the neck. But my experience is that sometimes when you do this type of exercise, it's even counterproducing, because you can have even worse results. What is your experience with that?
You were talking about harmony, and the problem when we're aging, it's the fat is not go away. Some fat is leaving and some fat is staying. So it's a repartition of the fat which change, and the muscle is the same. It's not that you are losing in general the muscle, but it's a different also repartition. And when you are talking about neck, for example, you know that here is a platysma. Normally you can't see the platysma when you are young, but with the time with exercise you begin to have these bands, platysma bands, because you have an hyper stimulation of this muscle. So I think it's complicated to say to people to do that, because we don't know how the body is going to respond, and perhaps it will be worse. So for example, for neck, well, we're working a lot with Botox. Botox is something we can stop the connection between the nerves and the muscle, so the information doesn't go to the muscle, so the muscle is more relaxed. It's not dangerous. It's something amazing. It's used since many years, and he was using it in a big concentration. Not, in aesthetic, is using like a drop. The only problem of Botox, and it's a big problem, it stays only 4 months, so it's addictive. So don't be frightened by the Botox. The only thing that is not something we stay for a long time. It's like makeup. It's good, but not long. So in the neck, we can inject some Botox in the platysma band, and we can relax, and that makes the neck look much more young. If you are doing this exercise, you are going to have this big band that is not very nice. In hands, I never heard about that, because I was thinking when you are moving that, you are more working in this
No,
arm.
but you have, remember the interossei, you have the lumbricoids and the interoids are the muscles that make you close and open your hands.
I never heard about that.
All this is fat, 50% fat, but it's 50% muscle. So you can obviously move it, and that's the reason why we lose weight. This is called sarcopenia. This is the most important problem that I have. Even more than sex drive, you know, my problem with patients is that they say, doctor, I'm losing muscle. I'm doing my best, I exercise, and I'm eating healthy, I control my stress, and why I'm losing muscle? This is something that is due to the aging.
And that can be compensated by exercise?
Yes, one of these is exercise, but exercise is not enough. There is a lot this is the new era of the anti-aging in terms of supplementation, because we have to try to block this process, because this is not only aesthetically, because obviously this is the effect of that, but the reason, you will be surprised, the reason why people die is a fall. When you are not 60, when you are 70, you have a stupid fall gardening in the bathroom, and after that you go to the hospital, you stay 4 days in the hospital, you have a deep venous thrombosis, and then you can die because of that, and people die because of that. If you have a fall, you know what is your family going to say? If you are 70, you say, no, don't go to your apartment, don't go to your house, it's better to go to an institution where they can help you, you can go to the toilet, blah, 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 and this is the beginning of the end of your life. So a fall with no energy, when you have a fall and you have no muscles here, you fracture your whistle, and you fracture your hip. This is the main problem. So, but obviously it's in an age older than we were talking. We are talking about the 50s, the 60s, but now we are talking about the 70s.
Yeah, but I think that also that loss of muscle is because of loss of hormone again, because
Yes,
this hormone was
absolutely.
stimulating the creation of the cells.
It's a combination
So I think
of...
it's a problem that you have at 70, but you have to treat at 50.
Yes,
so when the same.
absolutely. That's the reason why I say that the sooner the better you start, the sooner the better. Even before the menopause is overt, is clinically overt, you have to start to do things, okay? And not only hormonal, but exercise, stress management, healthy food, and many other things. And obviously, if we can compensate the internal treatment with the external treatment, well, we can get a wonderful harmony. So this is the goal, of course.
Okay, so your muscle and my skin.
Yes.
Huh?
Okay.
So thank you for listening to us. I hope that you have learned something. Me, I have learned a lot with Dr. Mera, so thank you.
Thank you very much. And well, we are here in SHA for helping people from inside and outside, okay? So we can get this harmony that is what we all look for.
Yeah, looking for harmony.
Yes.